The two systems are essentially intuition and analytical reasoning. Most of us get through life each day on intuition. We spend about 95% of our time in this intuitive mode. It's extremely fast, it's virtually reflexive in many situations. Most of the time it delivers a correct answer. The analytical mode is a little different. You really have to think about what you're doing to get the right answer. So just to give a clinical example, if I'm in the emergency department and a patient is brought in from triage and the patient is vomiting, they have flank pain, and the nurse says there is blood in the urine, my intuitive brain says immediately kidney stone, stone in the patient's ureter. But I have no proof for that. I haven't generated any hypotheses. I haven't gone into a lot of detail. I've just recognized a pattern. And that pattern recognition process is really intuition. And that intuition will be right most of the time. But the analytical approach to that problem is, what does a patient with flank pain, hematuria, and nausea have? What are the possibilities? And then you start to generate a differential diagnosis, and then you include some serious things that you must consider as well. That's analytical reasoning. The advantage of now having this model of decision-making, this dual process model of decision-making, is that it allows us to schematize what is actually going on in a physician's mind when they're making decisions. So first of all, you have the input coming in from the left, which is the information that the patient is giving to you. And that information, first of all, goes through a pattern processor in the physician's mind. And it's not a complicated bit of wiring. It's just simply your brain is built to detect patterns. If your brain detects a pattern and says, I recognize what this is, you go into the intuitive mode, which takes you straight through to the diagnostic endpoint. And that process can take as little as a couple of hundred milliseconds. So that's the intuitive mode. If your brain does not recognize the pattern, this is new information, and you haven't seen it before and you're trying to integrate it, then you go into the analytical mode, and this is the purposeful, forward-looking, deliberate channel that will take you through to a conclusion. But the length of time you spend in that analytical mode may be as long as several days while you're waiting for follow-up studies and imaging studies and so on. But those are the two basic modes. Intuition, very fast, reflexive; analytical, slow and deliberate. The toggle function simply means that you don't get yourself into one mode and stay there necessarily. You can move between the intuitive mode and the analytical mode. But people should be aware that if they're tired, or if they're sleep deprived, or if they're emotionally upset, they will tend to be in the intuitive mode. Only the analytical mode will give you the definite answer. So if you're thinking about a patient with chest pain, say, that comes into the emergency department, and it's a sort of vague pain that doesn't really fit any particular pattern, the only way you're going to answer that important question, is this patient having a problem with their heart, or is this muscular injury to the chest wall that I don't have to be worried about? The only way you'll be able to answer that question is by taking a detailed history from the patient, examining their risk factors, doing a thorough exam, and then doing various kinds of imaging, like cardiogram, chest x-ray, measuring certain elements in the blood. That is the analytical approach. Most of the time, you can trust your intuition, but when it really counts, when it's important, you have to be in the analytical mode.